Okay. Hello. Nice to be here. I'm Mandy Cheetham, and I'm a research fellow at Northumbria University, and I'm going to be presenting with my colleague Steph Morris from Newcastle University. So we're going to be talking about a study about universal credit and its effects on the mental health of claimants in North East England and Scotland. And these are what we might describe as findings which we're sharing painfully early. So we're in a very early stage of our analysis, and it's great to be here to talk through. So I work very closely with Steph and a colleague from Glasgow University, Marcia Gibson, and the study is led by Peter Craig from Glasgow and Claire Bamborough, who many of you will know and was here this morning. So I didn't want to assume that everybody knows about universal credit, so we thought we'd do a very rapid whistle-stop explanation about universal credit, which has been a massive change to the UK social security system. It combines 6 benefits into one, so it replaces what some of you will know as income support, employment and support allowance, job seekers allowance, working tax credits, child tax credits, and housing benefit. So it has and is a massive change. The aims, when it started in 2012, were to simplify the benefit system, encourage people into work, make work pay, and reduce fraud and error in the system. But most of you will know and will have seen significant problems with implementation. There have been huge delays, and now the current target for rollout is 2024. So the study built on work that we did in the northeast of England as an embedded research project in a community setting in northeast England, where I'd been asked to go and talk about childhood obesity, actually, but what people were really talking about were their concerns around the rollout of universal credit, which then was very new. So there was something about being responsive to what communities identified. And the kinds of things that people talked about and were concerned about were the digital online claims process, use of the online journal, which was very new for people. They reported mixed experiences of work coaches and concerns about the kind of conditionality. So when we talk about enhanced conditionality, what we mean are the kind of work search activities that people are required to do to fulfill their claimant commitment. And the penalties which can result in a sanction, and sanctions can mean that people's benefits are stopped for up to a period of 181 days. So they are significant potentially. Also important to know that there are work capability assessments for people with long-term health conditions and disabilities, some of which can result in massive delays in people getting their money. And to date, there's been no formal evaluation by DWP, and the latest equality impact assessment was done in 2010. So there are significant gaps in our knowledge and understanding about the effects of universal credit. So I'm not going to spend very much time talking about this slide because I want to hand over to Steph. She's going to talk about the really important stuff, but the Quali work package is one of 5. The first is a quants analysis of large national data sets. Work package 2 has also looked at citizens' advice data from 2017 to 2021 to understand patterns of help-seeking behaviour. We're going to talk to you about work package 3, and work packages 4 and 5 are some health economics modelling and some dynamic microsimulation that I am certainly not qualified to talk to you about. So I'm going to hand over to Steph and then be quiet.
So yeah, today, so as Hannah said, today we're going to be focusing on some early insights from qualitative longitudinal research study. This study aims to understand really how people are experiencing universal credit, how people's health is affected by claiming and living on universal credit.
how health is affected by claiming and living on UC, and how all of this changes over time. So we're using qualitative longitudinal research because it's a really powerful methodology for tracing how policy and practice is really linked to people's experiences. And we're conducting 2 waves of in-depth interviews with people claiming UC in 2 different locations. That's Glasgow City and also Tyne and Wear. And to date, we've conducted 60 interviews. And we're aiming for approximately 80 participants. Now we're taking a thematic approach to analysing our Wave 1 data and are currently coding our interviews, as well as creating case summaries that we'll add to when we conduct Wave 2. So here is just a timeline of our study as a kind of overview for you. As you can see, we're coming to the end of Wave 1 interviews, and next year we'll be doing interviews with staff supporting people with universal credit, and also our Wave 2 of interviews lined up, where we'll also be using like photo elicitation methods. So it's just a brief overview. Now, for our sampling and recruitment, we had really significant input from public contributors. That's in terms of our recruitment process, also into our funding application, our recruitment materials and interview design. And we're aiming for our sample to reflect the diversity of the UC caseload. So that's in terms of things like age, household type, gender, health status, ethnicity, and also employment status. So we've been recruited to enable this kind of diverse sample. We've been recruiting via a range of voluntary sector organisations and community organisations, as well as things like housing associations and trade unions, to try and get those people who are in paid work as well. And we've been continually monitoring our sample and targeting our recruitment as we go along. So here's an overview of our sample to date. You can see that we've got a really good mix of ages, genders, household type, people with or without children, and also 2/3 of our sample have got health conditions, which is very much reflective of the universal credit caseload. And those are the people that you'll primarily be hearing from today. So here are some early insights in our analysis. We're seeing that people are, as you would imagine, experiencing severe financial hardship and distress. Universal credit payments are often just not enough for people to live on. People are borrowing, experiencing stress, a sense of worthlessness, and a lack of control. Universal credit advances are making this even worse, as these advances are taken out to cover living costs during the 5-week wait, when people are waiting for their first payment. But these advances are often not enough to cover those expenses during that first month, and then monthly deductions to then pay that advance back just reduces people's income for up to 2 years. And as these quotes show, the effects are stark. So here we have a single parent, Stephanie, who explained that she kept money back after paying her bills, but it didn't last. She said, "I starved for weeks, I was living on porridge, I lost so much weight." Another single parent, Faye, who has mental health problems associated with domestic abuse, said that this financial distress she's experiencing made her feel really inadequate and like not a proper mother or a proper adult she couldn't provide for her children. So secondly, the UC digital system is also affecting people greatly. While some people prefer the new system and find it faster for communication and easier to manage with fluctuating earnings, other people are experiencing lots of waiting for replies, confusion and stress. And the automated messages in particular are very problematic for people who experience anxiety and other health conditions. And some described it as dehumanizing, and Anna here described it as psychological torture, intimidating and scary for someone like her with anxiety problems. So third, sanctions are a key aspect of UC negatively impacting on people's health. Sanctions are when people's payments are withheld or reduced for things like missing appointments. And some participants had experienced sanctions and described really severe stress, worry, worsening of high blood pressure for one participant, effects on their sleep and having to borrow just to survive. But also the threat of sanctions had a really negative impact on people too. For example, here, Ricky says he couldn't sleep at night, thinking if the payment doesn't come through. Derek explained how when he'd had a sanction in the past, he was feeling suicidal. And Gillian described her anxiety going through the roof. And fourth, people on UC have these work capability assessments, as Mandy mentioned, if they have a health condition. But people are waiting really, really long times for these assessments, and then even longer for their outcomes of these assessments. But during this time, they're having to put in these sick notes from their GP, but they're often still required to do some form of work-related activity, like creating CVs or going on courses and having work-related interviews with the job centre, which they've found largely pointless, especially if their conditions mean that they are completely unable to work, and it's just extra stress that they didn't need. So, for example, Derek here explains how frustrating it was to have the same conversation with his work coach over and over again, and he didn't feel that he understood his worsening health and inabilities to work. So this waiting in limbo often led to a great deal of uncertainty, lack of control, frustration, and more financial hardship, as people during this time are receiving no extra funds to cover the costs of their disabilities during this time. And lastly, work coaches are a key feature of universal credit, and our participants with health conditions have often said that they found their work coaches had little empathy or understanding and flexibility, which could make them feel even worse. And changing work coaches over and over again also meant that people had to repeat explanations of their health or their trauma, which many people just found exhausting, upsetting, and really stressful. However, there is a little bit of light. Supportive work coaches have been really crucial for some people and had been a bit of a buffer to the other effects of UC. For example, Faye explains here how her work coach recognised she'd been through a really difficult time with domestic abuse from an ex-partner, and that she was really understanding and had a lot of empathy, and that just really made her sort of have a better experience with the job centre overall. So work coaches who tailor commitments to people's health conditions and circumstances are really valuable. So just to sum up, today I've just shared some of the mechanisms within the UC system that are causing harm and affecting people's mental health. We're continuing our analysis and involving public contributors in interpretations and recommendations going forward. And we're just starting some really exciting creative PIE work too. We'll be running poetry and photography workshops in the new year, which will culminate in an exhibition. And as we're continuing, we're also feeding our early insights back to DWP to inform policy and practice around the move to UC, which aims to be completed by 2024. So thank you for listening, and just a couple of acknowledgements that, from the NIHR, also to our other colleagues on the project, our public contributors, voluntary sector organisations that have helped us recruit, and also, of course, our participants. Thanks.